Good afternoon, everyone. We're going to go ahead and get started. Welcome. Thank you for joining us for today's webinar. My name is Caryn Bell, and I'm an Associate Director for Partners for Advancing Health Equity, or the P4HE Collaborative for short. We are a national research learning collaborative that aims to bring together various sectors that are working on health equity, including government, academia, community-based organizations, philanthropy, and the private sector. Here at P4HE, we convene these sectors to work together to better understand critical issues related to attaining health equity. We are based at the Tulane University School of Public Health and Tropical Medicine, and we are sponsored by the Robert Wood Johnson Foundation. For today's webinar, we will engage across sectors to discuss advocacy and activism for health equity. Recognizing that racism, sexism, and other structural and systemic forms of marginalization are root causes of health inequities is a major step forward in the field of health equity. However, this recognition alone is not enough. Understanding and collaborative work across multiple sectors is needed to build community power to affect structural change. In a recent webinar, we talked about building community power, and today we will bring together cross-sector voices to discuss concepts related to advocacy and activism for health equity, and give attendees actionable steps and tools to participate in advocacy and activism as well. So before we hear from our panel, we want to hear from you. As always, we want your perspectives to drive today's conversation. We will be using Mentimeter, which you can access by scanning the QR code on your screen or by going to www.menti.com on your browser or mobile device and entering the code seen on your screen. So we're collaborative. I'm going to do the same thing. I'm going to go to www.menti.com and I'm going to type in this code 32446054. All right, and hit join. And when you have joined, you can give a thumbs up to let us know that you are in Menti. You are right along with us and along for the ride. Okay, so yes, we have people joining, and I think we can go to the first question. Okay, the first question asks, what does activism look like to you? So spend a couple of seconds, maybe a full minute, to think about what activism looks like to you. I'll also participate, and we'll see what we're thinking here. And you can also submit multiple responses. So if you are, a popcorn thinker and you're just thinking of different answers, you can go ahead and put that in multiple responses. I see in the chat, someone said, can you please reshare the QR code? I think what we can do is, rather than reshare the QR code, you can go to menti.com and type in the code 32446054. And that should get you to the same place as Menti. Yeah, okay, great, thanks. I'm glad that you got that. Okay, so we have the responses here. What does activism look like to you? Someone said outreach, speaking up, political engagement. Yeah, we're going to get into that actually a little bit next month in our webinar, but we'll potentially get into it today. Being on the front line, collaboration, taking a side, interesting. Humility, also interesting. Blood, sweat, and tears. Growing a garden of people I care about to fight alongside me against injustices. Wow, that's deep. Putting desired outcomes first, wholeness, amplifying voices, change makers, speaking up and out, active involvement in making change happen. Wow, so many responses. Thank you all so much. Educating. The first thought is the U.S. Civil Rights Playbook of street level boycotts and protests, but it's also about changing laws. Okay, there's a lot here, and our panelists, they're on the line. They'll be able to respond to your responses. I think we can go to the next question, however. It says, what does advocacy look like to you? Okay, so we asked before, what does activism look like to you? Now, what does advocacy look like to you? You can type in your response. I'm going to do the same and give my response. What does advocacy look like to me? All right, so the responses are rolling in. What does advocacy look like to you? Really, we could say, what does advocacy look like to us? Because we are all participating. Here, I see speaking up multiple times, communication with leaders, support, okay? Elevating voices of those who are silenced, speaking up and setting up, educating stakeholders, okay, decolonizing my thinking and inviting others to do the same. Wow. Okay, speaking up on behalf of a population to affect change, engaging with policymakers from local issues to a broader scope, okay? Putting yourself out there for those who cannot, doing something to evoke change, breaking silence. Okay, I'm hearing a lot of things about speaking up. I think that's the theme. Advocating toward activism, whoever put that, thank you for linking the two concepts together, first of all, but also that is a very important concept as well. Comfortable with being uncomfortable. Okay. So we appreciate, and you can keep adding to the list as you would like, and as you think of more things. You can also continue to share your thoughts and comments and questions in the chat throughout today's discussion. And additionally, you can also join this conversation with your questions and comments beyond this webinar on Twitter by using the hashtag partners, the number 4HE. So we're actually going to ask our panelists about what you all said, but first I have to introduce them. So first we have Denise Hyater-Lindenmuth, who is the Executive Director at National Women's Health Network. Denise, welcome.
Hi, good afternoon, everyone. Thank you for that introduction.
Thank you. And I'm going to ask you to share more about your work in a minute.
Sure.
So yeah, great. Thank you for joining us. And next we have Adam C. Alexander, who is an assistant professor in the Department of Family and Preventive Medicine at the University of Oklahoma Health Sciences Center. Adam, welcome.
Thank you for the introduction. Very excited to be here.
Yeah, awesome. We're excited too. I think I want to start out with asking you all your reactions to the audience's responses to the questions, what does activism look like? And what does advocacy look like? Because I saw some stuff, but I want to hear what you all think about those responses.
I'll start first and say, I think a lot of them was spot on, right?
Yeah.
Advocacy
I
versus
agree.
activism, yeah.
What about that difference? Well, one of the things that I saw was when we asked what advocacy looked like, people talked a lot about speaking up and being a voice for those who might be rendered voiceless. What did you all think about that? That really stuck out to me, rather. I was going to say spoke out, but wrong choice of words. What did you all think of that?
I think both speak to help affect important social, political, cultural changes. Advocacy, to me, is about education.
Okay.
It's educating your stakeholders. I think someone said that exact same thing. It's educating your stakeholders. Could be political, could be grassroots, could be somewhere in between, right? Whereas activism is really putting boots on the ground.
I agree 100%. I look at advocacy. I think someone said when they were describing it, is like giving a voice to the voiceless, or for those who perceive themselves to be voiceless, and just educating the public about a particular issue. Whereas activism is maybe the next step after advocacy. When you educate the public, now you're ready to take action. You know, act is in the word activism. And so I think that's what activism is really about. It's about mobilizing people to really make a difference after you've educated people on a particular topic through advocacy.
Okay. So I think that lets me know that our audience is obviously great, right? We have a great collaborative here. But I think that we can definitely delve deeper into this. So I think I want to start with Adam. If you could give an introduction for yourself, but also talk about how you've been involved in advocacy or activism in your work.
Of course. So I'm once again Adam Alexander, an assistant professor at the TSET Health Promotion Research Center at the University of Oklahoma Health Sciences Center. And here I do a lot of work focused on men's health, particularly in the area of cancer screening. And here in Oklahoma, across the entire nation, cancer is one of the leading causes of death. But here in Oklahoma, we really struggle in a lot of key cancers, including lung cancer. And the one I focus on mostly is prostate cancer within the Black community. Prostate cancer is the second leading cause of death here in our state. And the disparities are the widest here in the state versus the entire country, particularly among Black men. And but awareness about this, cancer is not, widely known. Many people don't talk about it. I've spoken with many Black prostate cancer survivors, and they keep their diagnosis and their journey private. And so when I became an assistant professor, I had the opportunity to try to make a difference in that area. So what I did was I met with local pastors in my community. I met with prostate cancer survivors, and we talked and we talked and we talked until finally we said we need to do something about this. And so in 2021, we started what is now known as the Men's Health Awareness Summit, where we actually sit down pastors, community organizers, prostate cancer survivors, just to chat about prostate cancer, the importance of prevention as it relates to that cancer, as well as what's it like to live with cancer. And what we found is that when we do that, a lot of people in the community come out, people open up and are willing to share their stories. And then the next step is that they actually want to engage in screening for those who have no history of screening for prostate cancer. And we've been doing this now for 3 years. And I think it's just served as a powerful way to not only do research, because I am a researcher, but to also to be an advocate about important health disparity within our state. So that's the work I do.
Thanks. I'm gonna ask some follow-up questions, obviously. Denise, can you go ahead and introduce yourself and the work you do?
Sure. Again, Denise Hyater-Lindenmuth. I'm the Executive Director of the National Women's Health Network. And the network is, of course, a 501c3 that represents the health interest of women across the life continuum. We maintain an intersectional focus on sexual reproductive health, maternal health, and the health and well-being of aging women. We work to improve women's health outcomes through state and federal advocacy, consumer health education, and grassroots technical assistance initiatives. And since our founding in 1975, we have empowered millions of women nationwide to access high quality health care. And I'm reading that because we are crafting this as I'm as I'm reading it. So it's kind of like building the plane as you fly it, because we want to make sure that we are capturing what we really do as an organization. We're coming up close to almost 50 years in being an advocate and an activist for women's health care. So, I have to do is look at how do we remain relevant in this new spectrum of healthcare. And I'm sure we'll talk a little bit about that later. But in taking our advocacy roots and our activism roots a little further, it's beyond sexual and reproductive health, but we want to make sure we include the whole spectrum of a woman's life all the way through aging, if that makes sense. So my experience, oh boy, my experience probably runs the gamut from diabetes education and awareness to cancer education and awareness. I think I cut my teeth in HIV/AIDS awareness in the 90s, so I was in the thick of it here in DC. I have since done brain injury awareness, and now I'm here looking at women's health in total.
Thank you both for that summary, sort of a high level view of what you all do and thinking about what advocacy can look like, because you both sort of described two different experiences of doing advocacy, health advocacy. as your job, which is something, we're going to talk about how people can be involved either work-wise or just in their free time. But what I wanted to lift up is that, when we plan these webinars, we shoot our shot, right? We see who we can get. And we just ended up with two people who do their work in two different gender identities, right? Prostate cancer in men, particularly Black men, and women's health across the life course, across the age spectrum. I wanted to ask about how you all saw the role of gender in advocacy. Is there something about working in women's health that can either help with doing advocacy or can be a challenge? And the same to you, Adam. Is there something about working in men's health that can either help or be a challenge?
Wow, that's a great question. I'm gonna say it depends. It depends on who you're talking to, and it depends on the issue. Because not everyone is going to be not necessarily for women's health or against it, but there are other issues that may align with that particular health issue. For example, the ACA, right? The Affordable Care Act. And there are issues within that act that align with making sure women, particularly older women, for example, have the proper Medicaid, Medicare coverage, right? They may need to access healthcare. That might be of great importance to some representatives, but to others, it's important if I can get my other bill through, right? So being here in DC, we get to see both sides of this. And we really have to make sure that we align ourselves with representatives that are going to be champions for women's health. And there are several, I mean, there are lots of them, but we have to almost break it down to issues like menopause, or there's the momnibus, which I'm sure you're all familiar with, right? There are also representatives that are interested in how can I say, period poverty. Okay, so we have to make sure that, we embrace what we're doing. It might not be in total with what we want, but we have to really align ourselves with where the issues are. If you look at our website, we have our policy agenda for 2024, and it clearly outlines what we anticipate we're going to be advocating for this fiscal year and this budget. Well, I guess the president releases his budget next month, right? So we want to also make sure we are aligning our efforts with the president's budget.
And for me, when working with Black men, where I seem to struggle or encounter maybe some resistance when we try to open up and talk about health. I mean, that's a very vulnerable conversation, especially when you're talking about such a devastating illness like prostate cancer. And Black men, they're really hesitant to talk about that topic, cancer in general, but specifically prostate cancer. And well, what I find is that they're willing to address any other issue, work issues, family issues, relationship issues. But when it comes to like sensitive health issues, the conversation stops, and they think that I'll deal with it when it happens. Prevention is a second thought to them. There's so many other pressing priorities, and so it's oftentimes very hard to be a kind of a men's health advocate because we don't put that on our priority list because we consider there's many other important issues to be an advocate for, which understandably so. But given that our state suffers, like I said, from many devastating health disparities that are mostly affecting men, we have to take time and really come together and speak about it. And what I found to be effective is when you bring prominent and respected Black men who are going through those issues, those health issues, and they open up, they serve as a powerful role model for other men to come forward and speak about their issues. And so that's what that model we've been following. And it's been very successful in at least starting a conversation about men's health. And so that's been my experience.
Thank you for pointing out this concept of vulnerability and having people who look like you being able to discuss this. I think what I'm sitting with also in comparing you all, which it wasn't our goal when we started out, but it just happened to work out this way, is how Adam, your experience seems to be more on the community level. Denise, your experience seems to be more on the policy leadership or public health leadership in the many forms that happens level. How do those conversations where you are doing health advocacy, what do they look like? Denise, when you're talking to congressmen, like you said, even considering the president's budget, right? Like that's a different level than doing community or grassroots work. What do those conversations consist of? What are some of the things that you are making sure that you talk about?
Well, Caryn, I'm going to say it really isn't that different because you are spending time educating about an issue, just like you would at a grassroots level, just like you would at a legislative level. And granted, it's not often you get to sit with a representative or a senator. I mean, sometimes you get lucky and you do. But let's be honest, you're sitting with a legislative aide, right? And someone who is focused on that representative's health agenda. So you're educating that person. But also we find it helpful when we are working with legislative assistants or legislative aides. They get the issue, but we also have a partner that can speak to the issue with us. So we're not the only voice they hear. Does that make sense? So, I mean, you've heard the term, there's power in numbers. If there is a partner, a grassroots partner that you can bring to the table to help articulate the issue, to help bring life, to help bring a lived experience, that's key. Lived experiences, I think, are the best way to articulate an issue because it makes it real.
And the community, conversations I have in the community are very grounded. I, as a researcher working at a cancer center or affiliated with a cancer center, my number one priority is cancer and ways we can prevent it. But when I'm out in the community, I know that there's other concerns that people consider very important. And I have to take a step back and listen. I can't always go into a meeting in the community talking about cancer. Sometimes they want to talk about mental health and suicide. That's also a big concern. And so when I'm having conversation with pastors or just community organizers or just people who are passionate about a particular issue, my number one job is to listen and to provide resources, where they are needed. And often that's not cancer, but the theory I'm working with my colleagues is that if we can address those other needs, those social needs that are prominent in the community, it might actually lead to people engaging in those preventative behaviors. And so I think when you approach it from that way, we actually could be doing a very big thing by addressing those other needs for them to one day engage in proper preventative care as it relates to cancer.
That makes sense. And I definitely wanted to ask Denise, you talked about women's health across the life course, excuse me. And when we met to prepare for this webinar, you talked about older women and things like perimenopause and menopause. If you could talk about some of the work that you're doing for older women and even younger women, whichever one you want to discuss. But I definitely think that we should be talking about aging as well. And so would you be able to share some of that?
Sure. We look at the population in total. Women are 51% of the population. And we are also reaching a silver tsunami. And I'm sure you've heard that term. The population is baby boomers, so, they're aging. With that comes certain chronic conditions that older women tend to face more as, let's say after menopause or postmenopausal. So if you look at the social determinants of health, right? How they're living, how are they financially sustaining themselves, how are they managing chronic diseases, we want to make sure that we are working to advocate for that. There's a couple of things that are surfacing. I don't know if I can really say so much about that, but um, we are positioning ourselves as with other organizations to build a coalition to look at aging. So working through DHS and other regulatory organizations, making those contacts to really be able to formulate our agenda so that aging people, women, are addressed in a variety of programs and services, if that makes sense, without going into too much detail, because that's a whole nother webinar. So, we look at chronic diseases, older women, particularly African-American women, are going to suffer disproportionately from some of these diseases like diabetes. But we're also looking at statistics that older women may not, particularly African-American women, also suffer disproportionately from homelessness. We want to advocate for women to be able to age in their homes. We all want to age in our homes with our families. But as we look at inflation and all of these other issues that are happening in the world, right? How is that going to look for us 10, 15, 20 years from now? So when I said I want to make sure that our organization remains relevant for the next 50 years, these are the issues that I want to make sure we're addressing.
I want to ask Adam about his research study, which is the other reason why we came to you. Is you published a study on how activism impacts mental health. And I wanted you to explain what the study was and the results, because I found the results not contradictory, but kind of surprising. So if you could just walk us through what you did and what you found and sort of the implications of those results, because I think it's a super important issue.
Okay, you promised there'll be no formal presentation, but no. So yeah, you're right. I did I think a great study shortly after the George Floyd murder in 2020. And so we want to look at the effect of vicarious exposure to trauma and the impact that has on mental health. And in terms of trauma, we're looking at police brutality. And in my mind, when I was sitting outside of or sitting in my apartment during the height of those protests in 2020, and I'm hearing the people outside engaging in activism, protesting on the streets against how police use of force in Oklahoma, I thought I think activism could really play an important role, not only in the response to trauma, especially political related trauma, but also can play an important role in how we respond mentally to an event. And so I looked at it, conceptually within a survey, cross-sectional survey, where I asked people, how often they view footage of police brutality and how emotionally distressed they felt after viewing that footage. And then I looked at whether or not they engaged in forms of social activism, and activism was measured in a variety of ways, such as talking with friends and family about a particular issue, to the point of calling your representative about a particular issue you're passionate about. And what we found that if you view footage of police brutality, or if you're emotionally distressed from viewing footage of police brutality, that's associated with poor mental health. But if you view that same footage, but you choose to engage in political activism, you actually have better mental health than if you were to not engage in social activism. But on the other hand, in a competing model, and this is where the confusion might come in, when you view footage of police brutality, and that kind of causes you to engage in social activism in response to viewing that footage, you actually may have poor mental health through the engagement in that social activism. Now, think about it in terms of real world activities. So if you oftentimes in a protest, there's the people who are protesting and there's police officers. And sometimes those situations can turn violent in some cases, and people can be exposed to additional traumas through that through that protest. And then on the other hand, when you're protesting, often change happens very slowly, you know, especially in politics and in Washington and your local, political institutions, it's very slow. And sometimes what happens with people who are activists, they get burnt out, or they lose hope. And that can also contribute to poor mental health. And so essentially in that study, I was trying to really test two competing models, looking at some of the positive ways that activism might be helpful, and also some particularly probably harmful ways that engaging in activism could contribute to. And I want to really discuss ways we can mitigate those harms. So when people engage in activism, they can still have positive mental health afterwards. And also to show people that engaging in activism is actually a positive thing to do when you've been exposed to politically related trauma.
First of all, thank you for explaining it. Not a formal presentation, like we said, but I appreciate you explaining it and walking us through your motivation for that study as well, because I think that, sometimes researchers, we're stuck in having to do research that is not necessarily aligning with our real lived experiences. So just talking about that really helped me understand your motivations. But I'm wondering about Denise as well, and you, Adam, how has that participating in advocacy and potentially activism, how can that impact you, or how have you seen that impact your health and well-being, and what should others be thinking about being involved?
You mean me personally?
Sure, if you would like. If you
Oh,
just
the
want to speak
organization.
broadly, it's totally up to you. Yeah.
Well, from a 30,000 foot perspective, I think it empowers women to be active in their healthcare. I think it also demonstrates that women can be great managers of their bodies. If you're talking about bodily autonomy, right, and sexual reproductive health. So I think it just, it's an opportunity to kind of steamroll, just build on, build on, build on, build on, and do positive things. I have seen very positive outcomes from, that type of motivation and that type of energy. If you look at some of the things the network is doing, we have spun off, if you will, some fiscal projects that really target very specific issues. One is called Plan C, right, where they provide, the birth control pill. We also have a fiscal project that works with telemedicine and telehealth during abortion. That's not what we do as the network, but we have supporting or more grassroots organizations that are out here doing this. I hope that answers the question. Okay.
And I think for me, how my research and what I do in the community, how that's really transformed, I think, myself as a person, is I've learned that, I have agency. I think, as a researcher, we're often taught that, we do a study, we write a report on it, we publish it, and that's the end of the story. But, I take it a step further. I try to translate my research to what's going on in the community. And so I'm actively involved, so I can see the benefits of my research. I can see how what I'm doing in the lab or in my office is changing people's lives in the community. And I think that increases my confidence about the path I've chosen to lead in my life. And I think, and I just love seeing, smiling faces in the community when you're really doing a positive thing and you're inspiring the next generation. So I just think it's really changed my life completely.
Thank you. Thank you both for sharing that. I think, it's important, particularly given the findings of your study, to really have a realistic but still optimistic view of doing this work, because it is sometimes an uphill battle, not sometimes, all the times, an uphill battle, right? And seeing that there are benefits not only to society, but to us personally, as well as organizationally. I think I want to ask a question about we've been talking kind of broadly about these topics without like having like a clear, concrete, like what does activism and advocacy do to advance health equity? So I will ask, in your view, how can activism and advocacy be used to advance health equity?
That's a great question. One, I'll say, whether it's activism or advocacy, if you're committed to it, you're going to be committed to it for the long haul. And you're going to have to, be able to handle setbacks and just, detours. But ultimately, I think it's the best path towards advancing health equity, because you have to have a team behind you. I mean, doing it by yourself is great to get things started, but that's a lot of work. That's a lot of responsibility when you're trying to tackle something as complex as health equity. And so first and foremost, I'm an advocate, meaning that I'm always, going to, be passionate about trying to address men's health within the community, getting men to actually open up and start talking about their physical health and mental health. That's step one, and when that conversation started, then we try to get groups of men together. And once we can get groups of men together, especially men who are excited about engaging in social movements and political movements, I think that's when we move the needle towards activism, and we go start meeting with our representatives. And I believe in local action. I know national action, especially for health equity, is definitely going to have the biggest impact. But I think we need those small wins before we go after the big wins, so we can build people's efficacy for being able to achieve those big wins. And so I believe going and talking with the local representatives and getting them excited about a particular issue, I think that's how I look at it. You start small and then you go after those big wins, and it's going to take time, a lot of time.
I echo that 1,000%. I don't think I can add any other insight to that.
Listen, we love a complete and succinct response to this question. I think also having that so well stated is something that our audience can take away from this. What I also wanted to ask you all is, how can people get involved? So like individuals, do you have suggestions for how they can get involved in advocacy or activism broadly, or even specifically?
I'll jump in first, Adam. I think it's follow your passion. If you have an issue, if you have a lived experience that gives insight into what that issue is, and you can help educate people about that issue, that's how you get in. It could be something regarding your health. It could be something affecting your community. It could be, you could be a caregiver, and it could be something affecting your parents, your grandparents, whatever the case may be. So it's where's your passion? It could be about, animals. It doesn't matter, right? It's just get involved, follow your heart. And just remember that advocacy and activism, it's a movement, not a moment. Okay. So if you're following your passion, you're going to be able to support that for a long time.
I 100% agree. I have nothing else to add to that.
You both did the same thing, which I appreciate. And someone in the chat said beautiful responses, and I agree. We have a question from an anonymous attendee who says, would love to hear the panelists speak, however applicable, about the role of partnerships with local government agencies, benefits and limitations, ?
Denise, would you like to go first?
I think you go first, because my response might be a little different from a national perspective.
Okay. Okay. I think there's a lot of benefit of getting your local representatives and institutions on board with what you're trying to do. But if there's, but that oftentimes requires a lot of time, and the issue you may be passionate about is maybe time sensitive. So sometimes you have to move without those organizations as partners. But if you continue to engage them, I think they can be of great benefit to what you're trying to do, because they can bring in additional resources to you that might not be available otherwise. And they can also introduce you to new stakeholders, and new opportunities can arise from that. So yes, if you can get your local representatives and institutions behind you, that is all the better. But if you can't, don't feel discouraged, proceed anyway, because often you have to demonstrate success before people come find you. Because I guarantee you, once you are successful, people find you. I take the Men's Health Awareness Summit, for example. When I've done it 3 years now. When I did the first one, we were at a local church. When I did the third one, we were at an actual conference center, and we were we had so much name recognition. We were actually able to get the mascot from our NBA basketball team to come and join us for the event. And so you just keep building on those blocks. You're going to start small, but eventually you'll get to where you're on everyone's radar.
Absolutely. And from a national perspective, it's the same steps. You're not going to deviate too much from that. We had a similar experience where we wanted to raise awareness around dense breast, and how women who present with dense breasts are often misdiagnosed with breast cancer because the cancer is not found. And because we partnered with an organization that also focused on dense breast, we were able to have a webinar with DeLauro, Senator DeLauro, to talk about that, because she supported it. So yes, absolutely. It's the same mechanisms, it's the same relationships, just on a bigger level though.
Great, thank you for answering that, and thank you to whoever asked that question. I appreciate it. Hearing the responses as well. I wanted to ask a question about sort of like core values. What, in your opinion, are some of the core values that are needed to participate in advocacy or activism? Maybe we'll separate them out potentially, but what are some things that people need to sort of hold on to be able to do this type of work? What are those values?
I'll jump in quick because I want to just correct myself. It was Representative DeLauro, not Senator. The values, wow, I would say integrity. I would say trust but verify, because there's a lot of information out here that sounds good, but it's not scientifically based. So trust what you're hearing, but verify that it's fact. And that helps you establish a sense of representation in this fight, whatever fight that is. So you don't want to be spouting, which I'm sure we see all the time on social media. You don't want to be spouting things that are not true. You really want to make sure that you are advocating and educating truth.
And I just want to add to that, is that other values I think that are really important is patience, humility, and also I think attentive listening. I often have a rule when I'm mentoring students and people who want to do community-based research, that if you're doing more speaking than listening, when you're in a meeting, then you're doing something wrong. And so you definitely want to be able to listen to others. That way you know exactly what their needs are. And another thing I think is just another rule that people should follow, that I really encourage others, is to if you want people to invest time in what you're passionate about, whatever issue, you have to invest time in them as well. I think often we go in with a lot of expectations of our partners, but they have expectations of us as well. And I think if we don't really try to balance that partnership in terms of providing for their needs and them giving back to you, then there's a disconnect, and ultimately there's not much happening from that partnership. And so those are some of the values I just wanted to add on.
Thank you. I think those were good, and we should all be incorporating them. into our work and into probably our daily lives. So thank you for those. We have another question. Do you have any recommendations for advocacy and activism when you are a part of an organization that does not support and may even penalize your actions and beliefs?
Can you repeat the final part of that question again?
Hold on, let me pull it up again. Okay, I'll just reread the whole thing. Do you have any recommendations for advocacy and activism when you are a part of an organization that does not support and may even penalize your actions and beliefs?
Wow, that's a tough question. And I'll speak personally about Oklahoma. So our governor recently passed legislation banning diversity, equity, and inclusion on our college campuses, and so that's caused a lot of confusion about the direction we need to go in as an academic system. And so if you're trying to do work in that space, that makes it very difficult to do work. And so I've talked with several colleagues who are passionate about that area and they asked for advice. And I said, if you still want to do this work, then you have to be willing to have those tough conversations with those people in power so you can find, that middle ground where you can still make progress. Because if you do challenge the system and still talk about issues that have now been, forbidden by law, that's going to create challenges for you personally, and it's ultimately going to lead to you facing hardships that would not otherwise happen in a different environment. So I think when things like that happen, you have to be willing to go directly to the source and battle it out there, and then find where you can work within a space and still achieve some of your passions. And so that's what I would recommend based off what the situation I'm currently dealing with here in Oklahoma.
Yeah, I would agree with that. If your environment is not nourishing or supporting you where you think you need to be, then it might be time to find something else that can. And that's just a reality of it. But see, you have to understand businesses are businesses. And a lot of them will, they may have policies where you might expressing your political position or an issue is not embraced, and that's their prerogative. So you have to kind of find that balance. Either you like where you are or you find someplace else. I hate to say it's that easy, but sometimes you just have to weigh that. And that's the final thing you have to decide.
Yeah, that's a reality for many people, and it changes over time. So yeah, thank you both for sharing that. I would also ask about doing advocacy and activism outside of your professional position. And you don't have to share, excuse me, that's something that you've done, but do you have any suggestions for people who might be trying to balance working at an institution or an organization that doesn't support what they do, but they're trying to do it outside of that? Do you have any experiences or comments about that?
I don't want to self flip it, but don't wear your company logo shirt to the don't do that. Um, don't put it out on your company's social media. I mean, this is we're in a different world now, so everybody can see what you're doing if you put it out there. So, I would say follow your passions and advocate for what you believe in, but just understand it may not be embraced in the workplace.
And I'll just add, keep it classy. Make sure that if you're going to be doing it outside of work hours, but you still kind of represent your organization, make sure that, the activities you are engaged in, you just keep it classy and professional. And I think that's all I can add to that.
All right, well, that is my last question. I don't see any other questions in the chat. Do you all have any closing comments or thoughts that you would want to share with us?
I would just say for those who are listening, if you want to engage in advocacy and activism, Again, follow your passion, decide what works for you, and just stick to it because nothing happens overnight. It's a slow walk, as we say, and it just takes time.
And I can completely agree with Denise's thoughts. I just want to add that, you don't need a big idea to get started, to make a change in your community. I think just going to a community event, a listening session, just to hear people talk about, their lives, their lived experiences, that's where it starts. And from there, you identify where you can help, where you can be of assistance, and just start small and go from there. And eventually you'll look back 10 years from now, like, oh, wow, I accomplished all of this based on that one single step I decided to take many years ago. So that's what I'll end it off with.
Yeah, okay, I like that. Thank you all so much. We really appreciate your time and your insights and you being here. You've added to our conversation broadly and specifically today. So really, thank you so much.
Thank you for having me.
Yeah,
Absolutely.
definitely awesome. Okay, so with that, we are going to close this webinar, but we'd like to learn from you about your practical, or excuse me, about how practical and applicable to your work the conversation we've had today is. So we'd like to invite you to fill out a short survey that you should be able to access through a link in the chat or by scanning that QR code that you're seeing on your screen. So you can, again, go to the link in the chat or scan the QR code on your screen. It asks really straightforward questions about how relevant the webinar was, how whether or not it increased your knowledge and comfort about the subject matter, did it expand your perspective on potential collaborations, things like that. We want to make sure that our work is informative and applicable to you. So go ahead and fill out that survey so that we can figure out if we are doing the right thing. You can also let us know by emailing us or through social media. So while you're filling out that survey, we can conclude this session today and invite you to join us on March 19th for our next webinar titled The Politics of Health Equity. So I said that we're going to be talking about politics and political stuff, and we are. You can register with the link in the chat or with the QR code on your screen. So again, on March 19th, our next webinar will be titled The Politics of Health Equity. You can also register for the second session of our workshop series titled Design Thinking for Design Justice. And that QR code is also on your screen and the link is in the chat. For more information about our upcoming activities, it's available on our website, partners4healthequity.org. You can follow us on social media and help us spread the word by sharing our content that most interests you in your work. See you all soon. Have a good day. Bye-bye.